So my name is Dr. Rangi Prem. I'm an interventional neuroradiologist at Queen Square in London. Yeah, sure. So I think the key takeaway message with using PHIL Liquid Embolic is the fact that it doesn't need a pressure cooker technique. You can form a very small plug before you get that forward push. And often you can get that forward push without any reflux early on at least. And one of its main advantages is that it permeates much more effectively than other liquid embolics on the market. And you can get quite distal penetration. You can also get good nidal to PHIL reflux. And in a jaw sitting, you can get from the nidal network into jaw branches much more effectively. It also opens up the door to a multi-pedicle technique, using the advantage that you don't need to use a pressure cooker technique. You can use multiple catheters simultaneously to get much more effective embolizations. The preparation with PHIL is very, very straightforward. There's no shaking, which makes it advantageous. It's, if needed in an acute setting, it's much more readily available to you. There's no prep of the catheter as well, in addition to DMSO, which is advantageous. Visibility, you do need to work with PHIL a little bit in terms of enhancing his visibility. But once you're over that little hurdle, the control is much better than the other liquid embolics that I've used in the past and currently available. I was going to say delivery is very easy. Once you've worked out that you don't need a big plug with PHIL compared to the liquid embolics, if you're patient with it, it will do pretty much what you want it to do. And once you've used a little bit more, you can get the liquid embolic to actually braid in different directions, which is much more favorable than the other market sort of providers. So I think it's very tempting to use what's the established sort of pathway with liquid embolics. So there are the providers, sure. But if you're willing to be open to the fact that there's potentially a better liquid embolic PHIL, it will give you better outcomes, safer outcomes, and actually allow you to take on more complex or challenging cases at an earlier stage in your careers. That's an advantage. So I was interested in hearing about the AVM session, particularly. I'm intrigued in some of the newer liquid embolics that are coming on the market. There's a few that are going to potentially offer several advantages, particularly with the permeation of sort of the radiopacity with some of the new liquid embolics coming through. There's a lot of talk about whether we should be doing multi-pedicle techniques, whether transvenous is the way forward. So there's a lot of challenging debate going on at the moment about techniques, strategies for liquid embolics.